In this presentation, I will talk about my work on integrating physics and deep learning for transmission-less attenuation conversation in clinical SPECT. SPECT is a widely used nuclear medicine modality for multiple applications, including myocardial perfusion scan and dopamine transporter scan. And in a SPECT study, the patient will be injected a radio tracer which emits gamma photons. Those gamma photons will be detected by a SPECT detector, and there are several imaging degrading effects in SPECT, including attenuation, which is a major imaging degrading effect that adversely impacts image quality in SPECT. And attention compensation is beneficial for visual interpretation and serves as a prerequisite for quantification tasks in SPECT. Traditional attention compensation methods require CT scan. However, many SPECT systems do not have CT imaging capability, and approximately 74% of SPECT scans are performed without AC worldwide. Even with a SPECT system with CT component, AC with a separate CT scan has several disadvantages, including slightly increased radiation dose, higher cost, and possible inaccurate diagnosis due to SPECT CT misalignment. So there's an important need for developing transmission-less attention compensation method, which conduct AC using SPECT emission data only. So in this presentation, I will talk about our work on developing and validating physics and deep learning-based methods for transmission-less AC in SPECT. We have two methods here. The first one is called CT-less, a scatter window projection and deep learning-based transmission-less attention compensation method for myocardial perfusion SPECT. And another deep learning-based transmission AC method is developed for dopamine transporter SPECT. Going to introduce the data CT-less, a scatter window projection and deep learning-based transmission-less AC method for dopamine transporter SPECT. So we use the same idea of assigning attention coefficients into segments of the attention map yielded by a segmentation network to estimate the attention map for the dopamine transporter SPECT, and we name this method called data CT-less. We conducted an in silico imaging trial to evaluate the data CT-less method, namely acid debt. We generated 197 virtual patients from clinical MRI and CT images, and simulated clinical SPECT systems and clinically relevant imaging protocol using CMIN. And then we compare the performance of data CT-less with CTAC method and method that typically used in the clinical practice when CT images are not available, the method called UX method. And we also compare the performance of data CT-less to another deep learning-based AC method that directly estimates attention distribution of each workflow called as the direct method. The primary objective of acid debt is to assess whether the correlation between the activity update obtained using CTAC and data CT-less was higher than the correlation between the UX method and the CTAC method, as measured by intra-class correlation coefficient, in short ICC. We observed that the ICCs between data CT-less and CTAC indicated an excellent positive agreement and were significantly higher than that between UX and CTAC. And we also observed that data CT-less yielded a similar performance to CTAC and significantly outperformed the UX method on the original update quantification as measured by normalized root mean square error. The secondary objectives of state acid that include to differentiate between patients with normal versus reduced treatment specific binding ratio values, and to evaluate the test-retest repeatability of data CDLS. Also, we evaluate the performance of data CDLS with different size of training data set. We observe that data CDLS performs similarly to CTEC and significantly outperform UAC on the task of differentiating patients with normal and reduced SPR values as measured by UC values. And in the test-retest study, we observe that data CDLS yielded similar within subject coefficient of variation with those of CTEC, demonstrating a good test-retest repeatability. We compare the performance of data CDLS to the acid delect method. As mentioned earlier, that the acid delect method estimates the attention coefficients, directly estimates the attention coefficients of each voxel. And we evaluate both deep learning-based AC method with different sizes of training data set. And we observe that data CDLS generally yielded higher RCCs than the acid delect method across different sizes of training data set. As a conclusion, we proposed a scalar window projection and deep learning-based transmission-less AC method for different transporter SPECT, namely data CDLS. And as evaluated in an in silico imaging trial, namely SDET, the data CDLS method yielded a similar performance as CTEC and significantly outperformed UAC on the task of regional update quantification. This work has been presented at IEEE, RSPI, and VITM conferences, and